All right. And then Dr. Eric, of course, as people come into the waiting room, you can admit them for me. First of all, I want to say thank you to everyone that agreed to take the time out to join us for this special webinar. Special thanks to all of our stakeholders at SNHU, Dr. T, we'll see this later, and Dr. Eric and Dr. Michael, thank you for being here. And to all the students and faculty and staff that decided to join us. And also special thanks to our guest, Megan, from the Clinton Foundation for being our guest presenter on today. So before we begin, I'd like to begin this special webinar with a moment of silence, just in the tradition of our training with Megan that we've been experiencing on this week. It's in honor of everyone who is in the field, who is battling with addiction and doing the work to overcome addiction. So if you will join me just in a few moments of silent reflection. All right. Thank you all for experiencing this moment of silence with me. And for those that are just joining today, again, thank you again for your time and attention. The title of the webinar on today is Addiction, Recovery, and Resilience. And our guest presenter is Megan Affrunti. She has an MPH and MSW, and she's the Senior Director of Substance Abuse Disorders and Recovery with the Clinton Foundation, a good friend of mine and master trainer. So welcome, Megan. Thank you for joining us.
Yeah, thank you so much for having me and good afternoon, everyone. It's great to see you. It's great to be here with you all and just so glad to see so many people show up to talk about these really important topics. I want to thank Professor Herriott for planning this event and for inviting me. As he said, I'm a senior director at the Clinton Foundation. I work on our overdose response network team. My background is in public health and social work, and I've been designing, implementing, and evaluating programs related to addiction and mental health for almost 20 years in different settings like nonprofits, local government, foundations, and community-based organizations. So this event is being brought to you as part of a program that I co-facilitate at the Clinton Foundation. It's called Empowering Faith Leaders. And Professor Herriott is part of the program there, along with 20 other faith leaders from the Birmingham, Alabama region. And the program trains and mobilizes faith leaders from all across traditions to confront the addiction and overdose crisis with science, with approaches based in science and compassion. We know that faith leaders are often the first point of contact for community members who are struggling with different issues. And in many cases, faith leaders aren't necessarily equipped with the knowledge and the skills and the resources to help. There are many studies that show that topics related to addiction aren't taught in seminary. And so this program that we've run in 17 communities across the country now tries to fill that gap. And as part of the program, each of the faith leaders who's involved will put together a community engagement event like this one. And the goal really is to break the silence around addiction, to start the conversation, and try to reduce the massive stigma around it that keeps people from asking for help and getting access to the services they need. So thank you again for being a part of this effort. I think it's really important and every little bit helps for sure. So I'm going to share my screen and put up a few slides here. Okay. All right. Can everyone see okay? All right, great. So this is what I'm hoping to cover in the next 45 minutes. I'm hoping I'm not being overly ambitious here, but I really wanted to try to be as comprehensive as possible while still being high level and concise. So I'm going to spend a few minutes just talking a little bit more about my program at the Clinton Foundation. I'm going to talk about the scope of the overdose crisis and how we got here in this country. I'll talk about our biological susceptibility to addiction and why addiction is considered a health condition just like any other. I'm going to talk about recovery from addiction, the different pathways that people take, and the pillars that support a lifestyle of recovery. And I'm going to talk about prevention, addiction prevention, and overdose prevention with the overdose reversal drug naloxone. Finally, I'll share some key resources for finding treatment and support for addiction. This is going to be jam-packed with information, hopefully all practical and useful. And I'm going to try to show a couple of videos along the way if the technology helps. I think it'll really support understanding some of the concepts that I'm going to talk about. So this is my team's mission at the Clinton Foundation. It guides all of our work and all of our programs in communities. So we combat the addiction and overdose crisis by increasing education and awareness to decrease stigma and curb addiction while providing communities with the tools and support to save lives. And these are our three kind of key program goals. I already talked about the first one, it's our Empowering Faith Leaders program. Through this program, we train and mobilize faith leaders to confront addiction and overdose and end stigma. We've graduated about 300 faith leaders from our program in 7 states across the country. And we're currently working in California and Birmingham, Alabama. Our second goal is to expand access to the overdose reversal drug naloxone and train people in overdose prevention. I'll talk much more about this later in the presentation. And we also strengthen and build support for recovery through a variety of initiatives that celebrate and strengthen advocacy for recovery. So we're going to switch gears a little bit and talk about some sensitive things, sensitive topic, the overdose crisis. And I'm going to use this image of a stadium to illustrate its scope. The largest stadium in the United States is Michigan Stadium in Ann Arbor, Michigan. It's nicknamed the Big House, and this is a photo of it packed to the rafters during a football game. The Big House seats 107,000 people. 107,000 people. Now, I want you to take a second and think of all those people gone. Every single one of those seats empty. In 1 year. That's how many people died from drug overdose in this country in 2022. It's really staggering, no matter how many times I share that statistic. The number actually went up from 107,000 to 110,000 in 2023. And 70% of these deaths from overdose include opioids, like the powerful drug fentanyl, heroin, and prescription pills that I'll talk much more about later. And I just want to say before I move on that the number that I just shared, 110,000, it doesn't include the 85,000 Americans who die each year from alcohol-related illnesses or the 49 million Americans who struggle with addiction every year. And it's really important to remember that these aren't just numbers, right? These are our mothers and our fathers, our sisters, our brothers, our children, our neighbors, our teachers. And I don't think that there's anyone at this point in our country's history that hasn't been touched by addiction and overdose. So here you can see the increase in overdose deaths since 1999 when we lost under 20,000 lives. So each blue bar here represents the number of lives lost due to overdose. That's more than 1 million lives since 1999. And again, while these numbers are just incredibly staggering, there is some good news It's hard to celebrate because it's so early and we've lost so much, but it's important to mention it. So provisional data that was just released from the CDC indicate that there were an estimated 80,391 drug over deaths in the United States last year in 2024. So that's a decrease of 26.9% from the 110,000 estimated deaths in 2023. While it's still a huge number, it hints that the prevention, treatment, and recovery efforts that so many have been working tirelessly on over the past several years might be working. So how did we get here? We say that there are three waves to our country's current overdose crisis. The first wave started in the and I'll say current overdose crisis because we've been through this before. It didn't look exactly like this, but there have been other periods of substance use related crisis in our country. This is just really focused on our current opioid overdose crisis. So the first wave started in the mid 1990s when pharmaceutical companies urged doctors to overprescribe opioids or painkillers like Oxycontin, claiming that they were not addictive, when in fact a person can become addicted to opioids after just 3 days of use. Um, it was all about profit for the pharmaceutical companies. They didn't care what was happening to people. The second wave started in 2010 when there was a crackdown on prescribing these drugs, and it became difficult for people to get painkillers from their doctors. So people turned to the street where they could get less expensive and more powerful drugs like heroin. Overdoses increased. Then the third wave started around 2013 with significant increases in overdose deaths involving synthetic opioids, particularly those involving illicitly manufactured fentanyl. So the market for fentanyl continues to change, and it can be found in combination with heroin, counterfeit pills, cocaine, and other drugs today. Fentanyl. So most of you have heard about fentanyl. It's in our news regularly. It's an extremely powerful synthetic drug that is 50 times stronger than heroin and 100 times stronger than morphine. Just 2 milligrams of fentanyl, which is equal to about 10 to 15 grains of table salt, is considered a deadly dose. Dealers are mixing fentanyl into street drugs like heroin and counterfeit pills, and it's caused overdoses to skyrocket. Opioids like fentanyl can slow your breathing, and they can cause overdose and death. And combining alcohol with other drugs like benzodiazepines and alcohol increases chance of overdose and death because it slows respiratory depression, increases respiratory depression. Okay, so I want to take a second to talk about fentanyls because they pose a really unique challenge, especially for our youth, and I like to raise awareness about them whenever I can. And I'd like you to have the information to share with your friends and your kids and other family members because it can save a life. So this is just a 3-minute, really short video. Let me just want to make sure that the sound is going to work. So let me just give me 1 second here. Forgot to do that before. And this is a film by our partner, Song for Charlie. They do a lot of work around fentanyls and educating youth on youth and family members on them. Okay, so let me know, please, if you can't hear anything or see anything.
You've heard about pills killing young people, right? A teenager takes what they thought was a prescription pill and never wakes up. We're not talking about a drug overdose, accidental or otherwise. We're talking about being fatally poisoned by a single pill, one that looks like a legit Xanax or Percocet or Oxycontin. Except these pills aren't legit. They're counterfeit, fake. They can kill you within minutes, and it's happening all around you. The fastest growing group of victims is young and inexperienced. They take pills
I
for
want to change
different
my name to
reasons.
Eric
Some
Jen.
of them are
I think
experimenting,
we're
others are stressed out and self medicating. Many victims died at home in their beds after swallowing just one pill. Every young person is at risk. So, what's going on? We live in a quick fix, pill popping culture, and we've been taught to trust prescription pills. In some cases, these medications are necessary, but they can also cause addiction. That's why we're in the midst of an opioid epidemic. So many people in the US became addicted to opioids that drug dealers started making fake pills to meet demand. The active ingredient of choice for these counterfeit pills? Fentanyl, a powerful synthetic opioid that's so potent it has to be highly regulated. There's no standard amount of fentanyl in these illegally made pills. They're not prescription medications. They're just thrown together in people's basements and garages with other cheap ingredients like filler powder, impressed into pill form. The dosage is never even. That's why they're so deadly. But fentanyl can be cheaply imported, and it's also highly addictive, which makes it ideal for creating fake pills. The drug cartels got involved too. They started to produce these counterfeit prescription pills containing fentanyl, known as fentanyls, on a massive scale, flooding the US with millions of fakes dressed up to look like the real thing. You can't tell them apart. Authorities can't fix this or make it go away, but you don't have to be the next victim. If you don't know where your pills are coming from, don't take them. Don't believe sellers on Instagram, Snapchat, TikTok, or any app. Don't believe friends who get pills from supposedly reliable dealers. Don't believe someone who says a pill has been tested. You may have heard of test strips that can detect fentanyl in illegally made drugs, but they're not reliable with pills, where fentanyl can be unevenly distributed. There's no way to figure out whether a pill contains fentanyl without grinding it up and dissolving it. In other words, destroying it. So if a drug comes to you in pill form, it hasn't been tested, period. And even if you test one pill in a batch, you have no way of knowing whether the other pills contain fentanyl. If it's not from a doctor or pharmacist, it's not legit. No random pills. Now you know the facts. Tell your friends, tell everyone you know. The more people who learn about fentanyls, the safer we're all going to be. You didn't create this problem, but you can be part of the solution. Help us spread the word. One pill can kill.
Okay, thank you for viewing that. I hope you found it helpful. I'm just wondering if anyone has maybe one reaction that they want to share, question. I'm always curious if the groups I'm talking to are familiar with this topic or if it's new. Any thoughts? No.
I do have a thought about it, because I am currently working with clients. I recently had a client pass away, in April. Um, and it was initially stated that it was fentanyl, but, we're not too sure or certain, if that was the cause. But learning that, the pills, um, they're not evenly distributed. That's, um, interesting, because I never even thought about it that way. And the reason I believe she passed away because she did receive it from like somebody she trusted and somebody off the street. They bought it off somebody like I guess it was marijuana. It was in the marijuana, um,
Mm.
and it was off the street. So she trusted that person and, left behind her two young children. So, it was very heartbreaking.
Hmm. I'm so sorry to hear that. And thank you for speaking up and sharing. This is just a really tricky topic because people are overdosing who aren't necessarily considered who you wouldn't imagine or call, a person who's addicted or, um, it can be sometimes someone who's trying drugs for the first time at a party and they have no idea that the pill contains fentanyl. So it's a real challenge, and I'm just glad that I had the opportunity to share that information with you. And I hope that you'll talk to your friends and family members and kids about it as well. So I know it's a tricky subject to talk about. There's a lot of, I'll talk a lot about stigma today and why it's a huge barrier and why it keeps us from talking about these issues. So I'm probably going to sound like a broken record, but it's important. And the next part of my presentation is gonna focus a little bit more on stigma and how we can end it. Whoops. So, so people use drugs for many reasons, right? For some, it's to mask the pain of trauma, neglect, and untreated mental health concerns. This is called self-medication when you're using a drug to treat a feeling the way that you're feeling. Nearly 40% of people with addiction also have a co-occurring mental health condition, which makes treating these issues even more complex. Most people who are in active addiction aren't using drugs or alcohol to feel good or to party. They're using it to avoid feeling horrible, to avoid the painful and sometimes debilitating effects of withdrawal from a substance. These people are often isolated, scared, and full of shame. This is because the stigma of addiction has permeated our society and shows up in our policies, our practices, the way that we interact with each other around addiction, and the way that we feel about ourselves when we're struggling. It can make us wrongly believe that people who are struggling with addiction should be punished instead of helped, when what they really need is love, connection, and support. Our systems have been set up historically to lock people up with addiction rather than help them get treatment and support. But this must change. And I think we're seeing a lot of progress in our country right now, although it's taken a very long time to get here. And there's still a lot of work to do. So, this is a long definition of addiction or description of addiction by the American Society of Addiction Medicine. Addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. Prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic diseases. So, bottom line, addiction is not a character flaw or a moral failing. It's a treatable, chronic medical issue, just like any other, and it indiscriminately affects people, regardless of their race, their sex, their gender, their ethnicity, their age, or where they live. I want to share another short video that explains our biological susceptibility to addiction. I think it does a really good job of backing up the idea that addiction is a medical condition, or as many people say, a brain disease. So let me share this video. This one's a little bit longer. It's about 5 minutes, but I think it's really good and helpful. So let me try to share it. And this is from a longer documentary, a PBS documentary called Addiction that we show as part of our program with faith leaders. It really does a great job of outlining the science of addiction and the evidence-based strategies available to treat it. It's free online, and I recommend anyone who's more interested in learning about it watch the whole thing. It's about 54 minutes in length, but this clip is just 5 minutes and 30 seconds. Okay. What is, hold on a second. There's something odd is happening.
Individuals struggling with addiction are actually battling millions of years of evolution because our brains are exquisitely evolved to seek rewards, to seek reinforcement wherever and whenever we can.
To understand how reward shapes behavior, Robert Malenka simulates a famous experiment. A mouse is attached to a fiber optic cable and placed in a cage with 2 holes. When the mouse explores the hole on the right, a flash of light sparks a feeling of pleasure in its brain. At the other hole, nothing happens.
Yep, there he goes again, right now. We are learning machines. Our brains have evolved to be exquisite reward seekers, and that was important for our evolutionary survival. But that came with a price, our susceptibility to developing addictions.
Obsessed with that burst of pleasure, the mouse will probe the hole several thousand times over the next hour.
I mean, look at this. He's just doing nothing else.
This experiment revealed the reward pathway in the brain, primarily controlled by a chemical messenger called dopamine. Dopamine tells your brain to pay attention, that whatever it just experienced is worth getting more of. It's released by endorphins, or when we encounter anything pleasurable or exciting. Especially drugs that can push dopamine levels 10 times higher than normal.
All drugs of abuse cause this unnatural rise of dopamine. And because of that, they're among the most powerful experiences our brains can have.
As drugs raise dopamine levels, they also alter the connections between brain cells, creating memories of euphoria that trigger fierce cravings. But it's not just about seeking pleasure. People struggling with addiction soon use drugs to avoid the pain of withdrawal.
Withdrawals will make your bones ache. I couldn't leave the house because I couldn't take a step without soiling myself from the withdrawals. You couldn't talk to me. I'd throw something at you or bite your head off.
When opioids are abruptly stopped, stress hormones are released at catastrophic levels. This imbalance triggers the opposite symptoms of opioid use, including shaking, anxiety, pain, and intense dysphoria.
Many times I would lay my head on a pillow and think, I'm done. I can't live like this. I don't want to be this person. And I would wake up the very next day and I would just do more drugs. I was powerless over my addiction. It consumed me. It owned me. I was a slave to it.
This cycle of addiction, says Dr. Corey Waller, starts as the brain struggles to rebalance as drugs overwhelm it with dopamine.
When that happens, the body decreases the production of dopamine. And eventually, you can't even get enough dopamine produced to get out of bed, let alone produce good relationships and good decision-making.
To understand what happens to dopamine, Dr. Nora Volkov has been imaging the brains of people with and without addiction to search for changes that occur with drug use.
We systematically were investigating individuals addicted to different classes of drugs, and we found that a common change across all of the different types of drug addictions was a reduction in the levels of dopamine D2 receptors.
The number of receptor proteins seen here as red in the brains of control subjects, are reduced in brains exposed to drugs. Fewer receptors means the brain is starving for dopamine.
Drugs interfere with your motivational drive. So imagine what it means to lose the motivation to do things, to just not have it.
And so anytime someone hears the term motivation, they should really supplant that with dopamine. Because without dopamine, you don't have motivation. And so when we look at a person who is in the throes of an addictive disorder and say they just need to motivate, we're telling them to somehow magically make dopamine.
Okay, so hope that was also helpful in really trying to describe our biological susceptibility to addiction and why it's hard to just stop using drugs. I think it's something that many aren't familiar with. There are a lot of misconceptions about drug use and why people use drugs, and so that's why I like to show that film to help clarify. And if anyone has any kind of reactions or thoughts or questions, I'm happy to answer them. Otherwise, we'll move on. Okay. Okay. So, since we just talked about how hard it can be to stop using opioids, I wanted to talk about three FDA-approved medications for opioid use disorder: methadone, buprenorphine, and naltrexone. And the first two shown here, methadone and buprenorphine, are the gold standard. There's decades of evidence proving their effectiveness. They're associated with decreasing withdrawal symptoms, reducing cravings, improved social well-being and functioning, and reduced rates of drug use and death. So I don't expect you to read everything on this screen or really come out with a rich understanding of these drugs, but the point of this slide is just to say that there is help available, there is hope, and there are these proven effective treatments that have helped countless people recover from opioid addiction. So just a quick review of addiction to drive a few points home that I think are really important. Addiction is preventable, it's treatable, it changes the biology of the body. If untreated, it can lead to increased illness and death, and people can and do recover. So research actually shows that 7 out of 10 adults who have ever had a substance use disorder or concern considered themselves to be recovering or in recovery. That's about 20 million adults in this country living in recovery. Most Americans who experience alcohol and drug addiction in this country recover and survive. So please keep that in mind. I know this is a sort of heavy presentation with a lot of really challenging topics, but I think it's really important to keep this in mind, right? That there's so much hope. So a little bit more about recovery. There's different pathways to recovery, and what works for one person to find recovery may not work for another. So experts often talk about 3 different pathways or 3 different types of recovery. Clinical pathways, which involve professional intervention from healthcare providers, clinicians, or credentialed professionals. These include formal treatment programs, some use medications, like we just talked about, and others use holistic therapies like hypnosis, yoga, and meditation. There are also non-clinical pathways. These include peer-led support groups like the 12-step programs of Alcoholics Anonymous or Narcotics Anonymous, and faith-based recovery groups like Celebrate Recovery. Self-managed recovery is something that many people also use. It's also called natural recovery, when they recover without following a formal process or engaging with professional services. They just stop. Once a person's in recovery, sustaining that recovery is the next goal and really requires a village. The 4 major pillars to support a life in recovery are home, a stable and safe place to live; health, which means overcoming or managing one's diseases or symptoms, for example, abstaining from substance use. And for everyone in recovery, making informed, healthy choices that support physical and emotional well-being. Purpose. This means having meaningful daily activities such as a job, school, volunteerism, family caretaking, or creative endeavors, and the independence, income, and resources to participate fully in society. Finally, and perhaps most importantly, community relationships and social networks that provide support, friendships, love, and hope. I think we all have a role in supporting people around us, especially if we know that they're in recovery. These four concepts, things, are so important. And if one is missing, it really impedes a person's chance of staying in recovery. So let's shift gears a bit and talk about prevention and how we can help keep ourselves and the people we love from having to go down such a challenging path to begin with. There are so many factors that determine whether someone will become addicted to drugs. These factors are biological, genetic, sociocultural, psychological, and so on. However, prevention is key. Here are a few tips that can reduce your risk of addiction and those you love. So first, if you're prescribed a medication, ask your doctor to describe the risks. About 2.5 years ago, I had a C-section after to deliver my twin babies, and the doctor gave me a bottle of 30 Percocet and didn't talk to me at all about the risks of taking Percocet, about postpartum depression, and how that might be a challenging thing, especially given that I had now 30 pills of Percocet. And, and I asked him. I asked him for information. I work in this field, and I just thought it was totally unacceptable that he didn't give me a warning or really any education when handing me 30 pills of Percocet. So ask your doctor to describe the risks. Challenge them. It can be fun. Only take prescription medication that is prescribed to you. Don't share your medication with others. Take medication as prescribed. Don't use medications in greater amounts, more often, or longer than directed by your doctor. You can become addicted. Keep medicines in a safe place. It's best to store prescription medications in a place that can be locked, like a keyed medicine cabinet, to keep them secure from children and visitors. Finally, you want to dispose of expired or unused prescription drugs when you no longer need them. Remove them from your home as soon as possible to reduce the chance that others will misuse them. Research shows that more than 50% of people who misuse opioids obtain them from a friend or a relative without their consent. That's an important statistic to be aware of. So preventing opioid overdoses, getting a little bit more specific. While using and misusing drugs always comes with risks, there are ways to reduce the risk of overdose by using more safely. So I'm sharing these tips. You never know who you can share this information with. A friend, a cousin, a colleague. It's very simple and I think it's simple and very practical. So that's why I'm passing this information along, because you never know when it can help. So if someone's using drugs, you want to tell them that whenever possible to use with someone else around in case something goes wrong. You do not want to be using alone. You want to start low, you start using a low dose and go slowly. You definitely want to avoid mixing substances, specifically opioids, alcohol, and benzos. Those are really bad drugs to mix. And you always want to carry naloxone with you. It can help you save a life. So what is naloxone? I hope that most people on this call have heard of naloxone. But if not, I want to share with you about it. So I have some right here with me. I always carry naloxone with me. It's in my car, it's in my backpack, it's in my bags. It's everywhere. I live in Jersey City, New Jersey, and I'm in New York City a lot. And you see people who could potentially be overdosing all the time. So, naloxone is an FDA approved medication that rapidly reverses an opioid overdose. It's like a magic drug that was created and approved by the FDA in 1961. It's just very recently become more accessible to people who need it. It attaches to the opioid receptors in the brain and reverses and blocks the effects of opioids. And it can quickly restore normal breathing to a person if their breathing has slow or stopped due to an overdose. Naloxone only has an effect if opioids are in the system. If I were to spray it up my nose right now, it would be like spraying water up my nose. It would have absolutely no effect on me. It comes in a variety of forms. Actually, it comes in, I think, 3 or 4 different forms. But the nasal spray version that I'm holding that you see here is by far the most common. And it's sold over the counter at most pharmacies. You can also get it for free from many state and local governments and harm reduction organizations. If anyone wants Narcan and doesn't know where to get it, please reach out to me. I'm happy to find a place that distributes Narcan where you live. So we're going to do a really quick training here. So how do you tell if someone is overdosing from opioids? First, you'll notice that they're unresponsive or unconscious. Their breathing has slowed or stopped. They may have blue, gray, or white lips or fingernails from a lack of oxygen, and they might be making snoring or gurgling sounds. If you see someone with one or more of these symptoms, you want to check for responsiveness by shouting loudly in the person's ear. If there's no response after you shout loudly in their ear, you want to do a sternal rub, which essentially is grinding your knuckles into their breastbone. This hurts a lot. And so if there's no response to a sternal rub, you know that it's an emergency. These are the steps that you should take. First, call 911, or if there's anyone around you, have them call 911. Yell down the street or down the hallway, get someone to call 911 if you can, so that you can begin giving the Narcan in parallel. So, open the container. You hold this red piece with your thumb, and you just push once up the person's nose. You do not want to test it. There's only one dose of Narcan in each one of these units. So you don't want to do a tester. Just want to make sure I get everything. So you want to spray in one nostril by pushing the plunger. If there's no response in 2 to 3 minutes, you want to give a second dose in the other nose, in the other nostril. And the reason you want to go in the other nostril is because there might be scarring or something going, or a blockage in the first nostril that you tried that is keeping from absorbing the Narcan. So you want to try the other nostril. If you're comfortable, if you know how to give rescue breaths or CPR, you can do that while you're waiting for emergency help. If you don't, that's fine. It usually works on its own. And then you want to put the person on their side in the recovery position. So this is what the recovery position looks like. It helps prevent choking. So the person's head should be tilted back slightly to open the airway. Their hand should be placed under their head for support. And their knee, you can see here, keeps the body from rolling onto the stomach. Naloxone works for about 30 to 90 minutes. And when it wears off, the person will probably feel really uncomfortable withdrawal symptoms, such as headaches, rapid heart rate, sweating, nausea, vomiting, and tremors. They may not be really happy when they wake up. Some will be angry. And so the advice is to just be cautious about that. Try to calmly tell them what happened, that they overdosed, and that someone saved their life with Narcan, and that help is coming. It's good to stay with the person as long as you can, if possible. Any questions on Narcan or overdose prevention? I know that was very brief and high level. Happy to direct you to more resources if wanted, but also want to give space to answer any questions if anyone has them.
I have a question.
Sure.
So I witnessed somebody overdosing on the side of the road, and I did not have Narcan, and I got some. That was 3 years ago. It's been in my car, in my glove box, like 2 or 3 years, however long ago it was. Do you think that's still good?
Well, that's a great question. So if you still have the box, every box actually has an expiration date on it. Um, Research has shown that unless your car is has been burning hot, like really, really hot, that the the effects that it's okay beyond the expiration date, up to a few years. So to be safe, I mean, I would say check the expiration date. Think about whether or not it's been really hot in your car. And if it has, then I would just recommend trying to find another box of Narcan. And I'm happy to help you with that.
Okay.
All right. We're gonna have time at the end for questions, so I'm gonna move on and just finish the content and then we can, come back to any questions that you have at the end. So just one last slide on Narcan and Narcan access. My team at the Clinton Foundation, we all believe that Narcan should be as accessible as fire extinguishers and AED machines. So we created this box. It's called the Overdose Aid Kit, and we hang them in public and private buildings like schools, churches, libraries, bars, and restaurants all over the country. There are about 4,000 of them out there, and the goal is so that people can access Narcan for free whenever they need it. And so as you can see in this right photo, there's instructions on how to respond using naloxone. There's also CPR breathing barriers in there, fentanyl testing strips, and resources for treatment and recovery. Some of the resources that I'm going to share on the next slide. So these are overdose aid kits, and we've received really great feedback that they've been helpful in times of emergency. So in conclusion, I just want to share a few helpful resources that I think everyone should be aware of. The first two are from SAMHSA, which is the Substance Abuse and Mental Health Service Administration. There's a national hotline that offers 24/7 support and guidance to treatment resources. I've actually used this line several times. It will connect you with a local person. So you basically tell them where you're based, and they'll connect you with someone in that state that can answer your questions and provide you with treatment resources that you may need that may be appropriate for whatever issue you're facing. So keep that number with you. SAMHSA also has findtreatment.gov, which is a directory. You can put in a city or a zip code, and you can find the treatment resources available both for substance use, and addiction. And then below, these are just some links. The first is to narcoticsanonymous.org and alcoholicsanonymous.org. NA and AA are 12-step programs. There's hundreds, if not thousands, of meetings happening every day all across the world to support people who are in or seeking recovery. There's also Al-Anon and Nar-Anon, which are support groups for friends and family members of people who are struggling with substances. So that's all I have for you. And I hope this was helpful, and I'm happy to answer any questions now, or jot down my email if you have a follow-up. I'm happy to talk with you. Thank you.
Thank you, Megan. It was a wonderful presentation. Now we'd like to open the floor for questions, additional questions from the people in the chat or those that are here. Type your question in the chat, or raise your hand or turn your camera on, hop on the mic. Yeah,
Oh,
good.
yes.
Yeah, good point. Oh, sorry, Dr. Eric just posted as we go into the Q&A. He's also sharing a link to complete a survey about today's presentation. It'll only take just a few minutes to complete that. Go ahead, Megan. You were saying something?
I noticed the chat about the survey, and I was just gonna ask that people complete it. It's always helpful to get feedback on these presentations and if they were helpful, or if there's information that you were hoping to hear that I didn't cover, information that was particularly helpful.
Jonathan Belmont posted, thank you for the presentation, that he had some internet connection issues. But he said, but what has been some of the initiatives you've seen by state, federal, or community level to address the issues?
Seen by state, federal, community. That's a good question. So I think one of the two major initiatives that I think have that researchers and experts think have played a role in the recent decrease in overdose deaths is increased access to treatment for opioid use disorder, those medications that I mentioned earlier. They are still there's still work to be done in terms of access for people, especially in rural areas, but there's more medication-assisted treatment than ever, and people are able to move on with their lives by getting this treatment. So I think treatment through methadone, buprenorphine, and naltrexone is one thing. Second has been naloxone. So naloxone access has increased dramatically over the past 5 or 6 years and has saved countless lives. That's why I always train on it and encourage people to carry it with them. If you are not alive, you cannot seek recovery, right? So I've met so many people in this field who've overdosed 1, 2, 3, 4, 5 times, and they're doing great today. It's incredible. So Narcan is a lifesaver, and it's been a major factor in the recent reductions. And I think just education, education is just another initiative. Again, people don't talk about this issue nearly as much as they should because of the stigma. And so just talking about it, getting the conversation started so that you can talk about it with your friends, with your family around the dinner table, it goes a long way. Someone's asking me to share my email. So I'm going to put my email in here. I received a couple private chats, and just in case I lose you, I'm gonna put my email in here so you can reach out to me. It's probably gonna be easier. I'm not gonna be able to respond to each person probably before you drop off.
Yeah, I PM'd Shannon also, put it in there for you.
Okay, thank you. So it's in there a couple of times.
Dr.
And
Michael has a question.
and this is my phone number too. Feel free to call or text me if it's easier. Someone said, I live in a rural area. Are there any initiatives to expand the overdose aid kits into these rural areas? Yes, we are actually doing a lot of work in Wisconsin right now in rural areas in partnership with county health departments who have opioid settlement dollars that they're using. We donate most of our kits to people who have to organizations with high risk and low resources, but we also sell them to people who have resources so that we can manufacture more because obviously there's a cost to manufacture them. So I'd be more than happy to talk with you about donating boxes wherever you live, Dr. Michael. And yes, we're actively, working to try to expand access in rural areas in partnership with governments and other local government and other organizations. Excellent. Yes, please reach out. Thank you. Those are all the questions I see so far.
Well, are there any more questions from in the chat or anybody on? Anybody want to share a brief comment, reflection moment? Jonathan Belmont says, in terms of prevention, there used to be initiatives like DARE. It doesn't seem like initiatives like that are promoted anymore.
I think there wasn't a ton of evidence supporting the effectiveness of DARE. I don't know if others on the call who work in this field are more effective with the research around it. I just know anecdotally that it wasn't shown to be that effective, but I don't know if others have more specific information. I mean, I think it's great that like it's unfortunate if nothing replaced it. Even if it wasn't shown to be that effective, at least it was starting the conversation early. I mean, I think I remember learning about DARE in elementary school, which is great. So yeah. Anyone? I think there are some. I mean, one of the issues is that it really varies by state and location. So, there are some cities and counties that have robust programs. Um, all of them are different. Many of them are different. And then there are probably some cities and counties that aren't doing anything. So I think DARE was one of the few sort of uniform programs that you saw across the country.
We have about 3 minutes left, excuse me, in our time. Final thoughts, reflections. Well, it is 12:57. I guess we can end there if there are no further questions. First of all, thank you to all of our student stakeholders and faculty and staff stakeholders that helped make this event possible. And special thanks to you, Megan, for putting together a wonderful presentation.
Thank you all for having me. It was great to be together.
Awesome.
Take care.
Thanks, everyone. Have a wonderful day.